Mic check, 1 2 1 2. Hi, my name is Jade. Welcome back to my channel if you have or have not been here yet. Thank you for clicking on this video. Of course, I am going to be like a big sister to you here today and tell you the real deal truth and insights on what it's like being a dental assistant. If you're just starting, if you're not just starting, let me give you a little bit of my background. I am on my pretty much third year of dental assisting, and some people might say, you know, that's a good amount of experience. Others might be in the field for now 10, 15, 20 years already and might say that I don't know all the full ins and outs. And I've got to say 100%, I'm not perfect. I don't know every single thing, but I learn as I go, and that is what this field is about. That is what a lot of careers are about. Consistently learning, trying to keep up with the technology that is happening on a daily basis, on a yearly basis, right? I currently am a clinical chairside dental assistant. I will say that there are levels to this in the dental field. I am not a CDA yet. I still yet have to take one more test for my CDA, but it would go from CDA, clinical chairside dental assistant, to a certified dental assistant, to an expanded functions dental assistant, also be considered a registered dental assistant, goes then up to dental hygienist, general dentist, and then there are specialties aside from that: orthodontist, endodontist, oral surgeon. Yes, it really has levels from there, and I have learned to not allow that to underestimate myself, discourage myself, because one thing I will say for sure is that I have entered the field. I have grown to love it very, very much, but I have finalized, I know that I'm not going to stay as a dental assistant. So I'm also very fresh into the career myself, right? I'm 2-3 years in, and I cannot fault myself fully, because I will say I am going to be starting my dental hygiene program in September. Yay! But not too much into that. We are here for the nitty-gritty of dental assisting, okay? Let me not downplay it, and you better not downplay it, and others who are dental assistants or just in the dental field period better not downplay it, because I will say it is a wonderful career. I love it very, very much, and I wouldn't have chosen it any other way. I mean, like, I get to show my 32 teeth every single day, okay? So I do have some notes here on my phone, so I apologize if I do have my phone in hand. But let's get started. The very first thing I have to say, it is way more than just helping the dentist, okay? Being a dental assistant can definitely come with a lot of commotion, of emotion. It's really way more than just handing an instrument to the dentist during a procedure, right? Because it also really depends on, once again, your role and the state that you work in, right? Because you could go from taking x-rays to sterilizing instruments, setting up and breaking down the rooms, to preparing the dental materials, assisting during the procedures, communicating with the patients. Throughout it all, you have to make sure you are maintaining the schedule, the doctor's schedule, and the appointment that you are currently in and with running very smoothly. A lot of the days you are going to find that you are doing 20 to 30 things all at once, and then next thing you know, you don't even realize that 3 to 4 hours have gone by. Next, you have to be willing to learn a lot, if not a lot, constantly. And I say that because when I first started dental assisting and I was in school for it, there were so many terms, there were so many instruments, there were so many procedures. A lot of it consisted of the same thing or the same instruments, same procedure, different terms for it. All of those abbreviations and terms that I have never heard before were very overwhelming. They were very overstimulating because I didn't know. Why? Because it was so new and it was so fresh to me, just like any other career, as I stated before. And you have to remember that it's okay. It is okay to feel chaotic in the beginning when it comes to learning all of these new things, because you don't know any of this yet, right? You have to practice. Practice makes perfect, right? You have to take notes. You have to ask questions. And when I say take notes, don't take notes and never look back at them. You need to take notes, you need to reread them, you need to reiterate them, and consistently practice them until you perfect them, right? But asking questions is very, very important when it comes to working with a dentist, or with the specific dentist, a specific dentist that you end up working with, because they all have their own way of working. And so if you want to master your dentist, or you want to master your office, you need to understand that it's going to take a few tries, many tries, and you have to fail before you upscale. It's me trying to rhyme, like, girl, bye. But I will say that the more you see, the more procedures that you practice assisting in, the more you're going to learn, and the more comfortable you will be eventually, especially building those bonds with the dentist. Being confused may equal not the best assistant, right? In the beginning, but once you're not, you're gonna feel that, girl. You're gonna feel the confidence and say, yeah, I'm there. If not, I'll get there. Número 3, the best one. It's not always glamorous. And just like any other career, you guys, there is never going to be a perfect aesthetic career that there is, unless someone is making it seem perfect. And you know who is doing that? Society. Us as people, we are filming these videos that are aesthetically pleasing, going to work, waking up early, putting on our scrubs, getting all our cute little attire, our bags. You are going to see an immense amount of glamorism in not even just this field, as I said, in so many other fields. But you need to understand that you're going to see so much, excuse my language, shit. You're going to see a tons amount of blood. You're going to see a whole bunch of nasty, gritty saliva. You're going to see a bunch of, I apologize once again, I don't mean to offend anyone, but you're going to see a lot of, crazy looking teeth. There is a ton of things that you're going to have to prepare yourself for. There's ins and outs, there's pros and cons to all of this. And I do have to say, if you can handle the not so pretty parts of the entire field, right, the whole cons of it, then trust me, you're going to enjoy the ride, because it's always a journey. Número 4. Your patience skills matter just as much as your dental clinical skills. Listen, you are going to get a lot of patients that are crazy nervous, scared. I mean, they have a phobia, okay? Walking into the dental office, walking into the dental chair. You will get patients that as soon as you call them up, they're going to start crying and tearing up, and you're going to feel like the bad guy as it is already, because that's how they see you, right? And you have to understand that as a dental assistant, we are the face of the doctor, pretty much. We are the first impression. We are the face of the office, if anything. Why? Because we are taking you in first, under our hands, and we are giving you that full love, that supports, that empathy, that sympathy that you need when you walk into our office, when you walk and sit into my chair, right? As for me, of course, like, I have to say, when I walk into an office, when it comes to any checkup at all, I expect the doctor's assistant to treat me with respect. so I can treat them with respect. I expect them to have a good attitude about what is going to happen today during my appointment in order for everything to follow through smoothly, right? So that is how you have to think of it. You have to think of it and act on it as if you were that patient in the chair and you wanted to be greeted, you wanted to be respected, you wanted to be asked how your day was, why you're here, why you don't want to be here. We are essentially the therapists, babe. Communicating, listening, and reassuring the patients, making sure that they are calm prior to the doctor or the dentist walking in, makes a huge difference as to how their appointment is going to turn out. Y el último. Use dental assisting as a stepping stone. And I say this with all love, with all kindness of my heart, right? Because one thing I do want to mention is working in the field the past 3 years, I have met many women, many men, more so women because it is a more woman-dominated type of field, but you know, all are welcome. All are welcome. It's a blessing, right? To be able to meet a lot of people that are multiple ages, different ages, working and doing the same thing that you are doing, and being able to gain insight off of that. And we really potentially, right, have the choice to either hold on to that and move forward with it in a good manner, or listen to it, see it, and then kind of let it go and shoo it and not care, right? This has truly been such a little journey that I didn't even realize I was building. I didn't even realize I was gathering into a little portfolio to be able to give this advice to you guys and to be able to share on how beautiful of a journey it is and it has been. So like I said, using this as a stepping stone, and especially if you are in your younger ages, and listen, you could be any age, okay? I'm only 22, so you could be 30 watching this video and following this 5th piece of advice. Like, go to hygiene school if that is your goal. Go to dental school if that is your goal. You know, if you genuinely feel that you are not fully financially happy, emotionally happy, mentally happy, physically happy with your career and that you are in currently, move up, elevate, do what you have to do in order to fulfill the internal you that feel needs that catering, right? Because you deserve it. Your inner soul deserves it, and you shouldn't hold yourself back for any reason whatsoever, any reason at all. And I'm no one to talk, right? Because no, I don't have a spouse. No, I don't have any kids. But one thing I will say is I have examples around me and people that I have met, once again, in the field that have kept going, and it's a beautiful thing to witness, might I say. So use this to allow yourself to understand, to be able to value the foundation and honestly the backbone of the entire career, because dental assistants do a lot. I have to say, we are pretty much the spine to it all, okay? I don't care what you say. If you're a dentist watching this, you know it. And I have met many dentists as well that are so wonderful, and I just cannot wait to continue, you know, networking and just meeting all of these wonderful people that are going to have a little snippet in my career. All right, so that brings us to the end of the video. If you are thinking on becoming a dental assistant, if you have just graduated dental assisting school, kudos to you. Congratulations, babe. I'm proud of you. This is only the beginning to a wonderful future, if anything, okay? If you did enjoy the video, I would like for you to comment, like, and subscribe. If you have any other questions, I would love to take a look. I would love to answer them and continue getting into the nitties and gritties of this, because once again, it's such an underestimated field. I feel it has such a history that it lacks the comfort and it lacks the love and just the full acknowledgement of how important it is to genuinely take care of your teeth. Babe, I had no braces and I don't play about my teeth, and I floss daily. I'm a floss fiend, and if anyone who knows me is watching this, they already know I carry floss everywhere. So I'm excited to get into it. One last thing I will say is I'm super excited to be able to finally give you guys my insights and my advice into what and how I've been doing these past 3 years, because now that I'm going to enter my hygiene program, I would love for you guys to follow my journey with me and for us to really, do this together, discover it together, in order for you, right, to also see if this is what you would potentially get into someday. So once again, like, comment, subscribe. Thank you so much for watching, and I'll see you in the next video.